I question the viability of UVC in these varied environments, right? So let's talk about the difference between doing something like whole room disinfection or an airplane disinfection versus an object like the sports balls you were talking about, because we're dealing with dwell time, we're dealing with energy distances. What are the different challenges versus those kind of different modalities?
Sure. Now, there are many chamber type disinfection units, and of course, Seal Shield makes an outstanding one.
Thank you.
But I think the way to look at it, the way to picture it and visualize it, and what we've done is to consider a room to be a chamber. And so, rather than having, something that's a foot by a foot by a foot, think about that chamber as being an operating room 20 feet by 20 feet by 10 feet high. And you want to disinfect the objects that are in that room. Now, you may be dealing with 10,000 times the volume that you are with a small chamber. So theoretically, you would need 10,000 times as much energy. And that's the failure of the stationary units, is that they can't possibly provide enough energy to effectively disinfect the contents and surfaces of the room. However, if you can kind of picture that chamber, and now all of a sudden you've got this device moving around the room and changing the angles of incidence so that you can get all the surfaces of the room, now it starts to make sense why you need that kind of design that's both mobile and can adjust the angle of the lamps. Because again, when you have a chamber and you have lamps on all sides, that's what you're doing. But a huge chamber like an operating room, you have to come up with a more creative solution, which is what we've done for the hospital rooms and operating rooms.